And of course, it can cause a lot of confusion and anxiety for folks.
Yeah, especially if you're one of the more than 1 million people in our state trying to enroll in Medicare, aging into the system. So we have a Medicare expert here to help. And this is, maybe people have loved ones who are aging into it, their parents, or they themselves are. So if they're watching, we appreciate you joining us from the Community Health Plan of Washington. Brisa Guajardo, thank you for your time.
Yes, thank you for having me here this morning.
So what's the biggest challenge people face and ask you? Like, question number one is what?
Why do I get so much mail? What should I pay attention to? I mean, just makes it so confusing for these individuals. And so those are some of the questions that we get that I kind of want to touch on today. Simply to help them navigate the system as they're choosing a plan for this coming year. So as you were saying, what do they ask me? The number one question, as I mentioned, why so much mail? What do I pay attention to? There's actually, if you're enrolled in a Medicare Advantage plan or a prescription drug plan, you get what they call an annual notice of change letter that basically is going to tell you, is my premium changing? So pay close attention to that, because you don't want to be surprised at the beginning of the year when it goes up and perhaps you weren't ready for that premium. How are benefits changing? Are they increasing certain benefits, adding certain benefits, or are they eliminating benefits? Will your providers still be covered, in the coming year as a contracted doctor, especially if you're in a managed care system?
Okay.
So that's one of the questions that I get.
Are there any big headlines this year compared to other years?
There's obviously more choices. There's a lot of plans out there that are offering a zero-cost plan. And just here in King County, oh my, there is so many plans to choose from. Which again, how do you know what's best for you?
Yeah.
Which route do I go? And as I mentioned, what is it that you're looking for as far as healthcare? Traditional Medicare doesn't offer those extra benefits like vision, like dental, and the prescription Part D, things that you have to get outside of traditional Medicare. So looking to Medicare Advantage plans, they provide those benefits. So example, Community Health Plan of Washington, one of our Medicare Advantage plans, I should say all of our Medicare Advantage plans, provide the vision, provide routine preventative dental. And so those are the things I want people to look at.
I thought Medicare covers everything. That's what everyone says. Medicare covers everything. You get to a certain age, you're set. You're saying that's not the case?
That's what people think. So Medicare is divided into two parts. Part A, which is hospitalization, covers you when you're inpatient in the hospital. Part B covers anything outside of that, like your surgeries, your office visits, lab works, x-rays. But then when you need prescriptions, it's not under Medicare. So if you go to the pharmacy, you need to have that Part D coverage to be able to get your prescriptions covered through a plan. So no, it does not provide those routine dental benefits or those routine eye exams. So that's why you want to look into what your options are.
Okay, and if you, I guess, are aging into it, right, and this is all new to you, where can someone go for help?
Absolutely. Well, here at Community Health Plan of Washington, we actually have representatives across the state. We work very closely with community health centers in helping educate their patients, that are aging in. What are your options? And truly, community health plan might not be for everybody, but you know what? We're there. We're focusing on what is best for the consumer, and we will guide them through that process. Okay. They could also call Medicare. I know right now it's a very busy time for them as well. So if you're calling, be patient. You could also call the SHIBA representatives, they're community volunteers across the state as well, who will help you look into the different plans and what it is that you're looking for.
Brisa Guajardo, thank you so much for joining us here on this Friday.
Thank you for having me.